Good morning for all. We have, I have to present the session of panel patient-centered care supporting those who care for use. Important topic today is, or actually, we're talking about partnership between patient and professional health. I will present the chair of the session, Dr. Rele Bonhail Ncha is representing the International Hospital Federation. Dr. Ncha is a health system and a preventive medicine specialist and has extensive experience within the public and private health sector.
Good morning once again, colleagues. I'm Dr. Relebohile Ncha. As indicated, I'll be the chair for the session. So this is quite an important session where we're talking to issues around supporting those who care for us. And I think for me, having been here yesterday, one of the phrases that stood out for me was no health without workforce. And this is exactly what this session is all about. We all can appreciate the fact that for health services to be delivered, the people who are at the center of that are healthcare workers. And also can appreciate the fact that over the years, there's been more attention focused on what healthcare workers do for patients and how they treat patients and how they ensure that the whole system works. But little has been done, or at least limited work has been done around focusing on the healthcare workers themselves. But I think, again, over the years, it's been showing that that is actually gaining traction, where we're now starting to focus on the health and the well-being of our healthcare workers. During the pandemic, that period actually showed us the resilience of our healthcare workers. We saw how dedicated they became. We saw how they sacrificed so much during that time. But also that time brought onto our faces, or at least onto our light, the fact that they're also human. And to the end of the day, they have emotions, they feel exhausted, they get tired, they do experience multiple emotions over the hours that they work at as they deliver the services to our patients. So again, that time brought focus to the health policy makers and health managers, the fact that it's about time that we focus on the well-being of our healthcare workers. And on top of that, taking care of issues around occupational health and safety, as you may well be aware of issues around PPE, etc., that are important for us. So now the message is quite clear that we need to take care of those who take care of us, so that ultimately when we leave that particular health facility, you leave with good outcomes because you've been treated with somebody who's at comfort, who's at ease, and whose mind and body and soul are also taken care of during the hours that they're actually working in our facilities. So we do have a brilliant panel that is going to take us through innovative ways and other ways of actually how we can enhance this issue of taking care of our healthcare workers. And to lead that, I'm going to introduce our moderator, Tonya Winders. Tonya is the president and CEO of GAP, the Global Allergy and Airways Patient Platform. She has over 25 years experience and has co-authored more than 80 peer-reviewed manuscripts representing the patient's voice. Over to you, Tonya.
Thank you so much. And thanks again to the organizers for inviting me to moderate this very important panel. So I have actually been here in Cape Town for the past 10 days. And I spent a bit of time on holiday, on vacation before. We also did a GAP board meeting and team outing to the Okay, so if you haven't, you really should. And the reason why I bring up the penguin colony is because I found so many parallels to this topic today. I learned a great deal about the South African penguins. So first of all, they live in colony, recognizing that they can't do it alone. They need one another. And that's very true when we talk about multidisciplinary team approaches in the healthcare system, right? We as patients and patient advocates can't do it alone. Doctors can't do it alone. Hospitals can't do it alone. Nurses can't do it alone. Allied health. So we're going to hear from all of those different perspectives. Secondly, there are no two African penguins that are exactly the same. So again, think about that in regard to this session as we go along. Next, they are extremely loyal to one another and to their colony. In fact, they mate for life. And so they choose their partner and they stay with that partner for their entire existence. And then finally, they share responsibility. Even when they lay eggs, they actually take turns between the male and female sitting on the egg every 2 hours. They alternate and rotate, and they share responsibility. And again, as we think about multidisciplinary teams and how we can support those who support us, this is so very important in how we share responsibility. So I'm excited to welcome the panel to the stage as I introduce each of them. Actually, we have a substitution for Andre Baguero for the International Council of Nurses. Now we have Howard Colton online. So welcome, Howard, to the panel. And then I'll invite Bob Mash from the World Organization of Family Doctors to join me on stage. Bettina Borish, who we have already heard from the World Federation of Public Health Association, to join me on stage. And Professor Dai from the World Medical Association, and Professor Danjama Ada from the Center for Initiative and Development to all welcome me here on stage. And we are not going to have formal presentations. We'll have just a time of questions. Apologies. We do have one fewer panelist, so I will skip him. So again, Howard, given that you are our online guest and we so appreciate you joining and stepping in, would you introduce yourself, please?
Hi, good morning, everybody. Sorry, I have just, can you hear me okay? I've just jumped off an aeroplane. And of course, as everybody knows, one of the occupational hazards for traveling for work is you pick up bugs. So my voice isn't great, but it's delighted to be with you. I'm the CEO of the International Council of Nurses. I'm also a nurse. The International Council of Nurses is the global body that represents the nursing profession. We're recognized by the World Health Organization. Our members are national nursing organizations, more than 130 countries who are members of ICN.
Wonderful. Thank you so much, Howard. And again, we will promise not to make you talk too much, but we certainly want to hear your perspective. Next up is Professor Bob Mash. He is representing the World Organization of Family Doctors, WONCA. He is family physician here in South Africa and has worked for many years with community health workers and in community health centers. He works for Stellenbosch University and with the Western Cape Government's Department of Health and Wellness. Welcome. Now, again, we've heard already from Professor Bettina Borish and her introduction, but in this capacity today, she is representing us or joining us as the CEO of the World Federation of Public Health Associations. And then Professor Dai, who again we heard from yesterday, is representing the World Medical Association. She's the founder and past director of the Steve Biko Center for Bioethics and the Wits Faculty of Health Sciences, professor of bioethics and health law of the Wits School, and the immediate past chairperson of the UNESCO International Bioethics Committee. And then again, we don't have Danjama. So again, a round of applause for our panelists. All right, So as we get started and thinking about, again, how we support those around us, I want to go first actually to Howard. So Howard, we heard yesterday about such an innovative program that WPA is partnering on to celebrate our nurses alongside Johnson & Johnson. And so the nurse role is one that oftentimes experiences high degrees of stress and burnout. Speak to us about how your organization is supporting nurses in this endeavor to, again, celebrate nurses, but also to address the stress and burnout of that profession.
So look, we're absolutely delighted that WPA are have this campaign to put nurses, to recognise nurses as being at the heart of health care. First observation, and this applies not just to nurses, but indeed to all healthcare professionals. We work to a code of ethics, which sets a really high bar. The ICN Global Code of Ethics, its opening line says that the needs of the patient come first, and your work, your energies, your commitment as a nurse is to meet patients' needs, to provide accurate and timely information, to be open, to be transparent, to answer questions, to raise concerns if there are issues that could create risks to patient safety, to be an advocate for the patient and the safety of the patient, and to give care not based on somebody's colour, creed, religion, ethnic minority, but based on their care needs. And I think that code of ethics, as I said, different for other healthcare professions, but containing many of the same principles, is why time and time again you'll find that when the public are asked who they most trust, nurses and healthcare professionals come top of the list. That said, we are working in an incredibly challenging time for nurses, for all healthcare workers. In nursing, we have a global shortage of nurses, estimated to be close to 6 million. There are about 28, 29 million nurses worldwide. What that translates to for people on the front line giving care is that their normal working day involves working with shortages of staff, not enough people. And whilst the code of ethics absolutely demands nurses to do their best, they know that when there are shortages, they have to make prioritization decisions. They can't give all of the care that they've been educated to necessarily to meet all of the needs that a patient may have. Now, you imagine if you have a code of ethics telling you to practice at one level, but the system you work with, the stress and strain that you're under daily mean that you have to compromise in your care. That has a huge impact on people's mental health, their sense that they're not doing what they were educated to do, and that creates risks, potentially harm to patients. We know from the evidence that where there are not enough registered nurses, the incidence of infections, trips and falls, medication errors, ultimately mortality as well, all go up. So when we think about nurses at the heart of healthcare, and I believe this applies to many other professions as well, it's actually two sides of the patient safety coin. We keep our nurses, our healthcare workers safe, properly resourced, supported to do their job. We're actually investing in ensuring that our working environments are as safe and as high, delivering as high a quality of care as they could have been. So I think there is a huge and enormous shared interest amongst nurses, patients, families and relatives as well, to ensure that the health facilities, the health systems that we all work in or are receiving treatment in are properly resourced. Back to you.
Absolutely vital to patient safety, and well noted that oftentimes in those surveys globally, nurses are one of the most trusted providers and voices in a patient's journey. So thank you for that. Bob, I'm going to come to you next, okay? So we've heard about the role of nurses and again, the importance there, and you're here representing WONCA. So tell us a little bit more about what WONCA is doing and your commitment to patient engagement management and patient safety.
Okay, thank you. Good morning, everybody. Yeah, so Wonka, every time I say that name to my wife, she laughs and thinks of chocolate. But yeah, Wonka is the World Organization of Family Doctors, so I'm here representing them. And so they're in, I think, 111 countries around the world, and we have about 500,000 family doctors as members of Wonka. That actually covers about 90% of the world's population. So I bring you their greetings. And Wonka, I think, and the World Patient Association are busy signing an MOU to work together on issues, obviously, that we have in common. 80% of healthcare, right, is in primary care, often with family doctors. I say often because if you're coming from, the North America or Europe, it probably is with a family doctor. But if you come from Africa or South Africa, actually it's probably from a nurse, and the family doctor is just part of the team and has a slightly different role. And in fact, in South Africa, family doctors are also at the primary hospital as well. So family doctors differ a bit around the world, but are at the front line of providing care for patients. And I would say, 80% of health problems, are in that primary care space. So we are very keen to collaborate with our patients. I was here for the session on patient safety, but also I think to advocate for things, and maybe I can talk about that later, but to advocate for some of the issues that we have in common. Yeah.
Yes, we will definitely talk about the common barriers and challenges facing all of the healthcare team. Okay, and so next I'm actually going to go to Dr. Nacha. Dr. Nacha. Oh, me, yes. So, I was like, is she looking at me? I'm probably pronouncing it wrong, so forgive me. But Hospital Federation and the role of hospitals specifically. So speak to us on how you believe we can enhance patient-centered treatment in healthcare facilities and hospitals specifically at this point.
No, thanks. I think from the presentation I did yesterday, one of the main focus that we have in terms of including patient safety in our facilities, it stems from the point of training. So we do need to incorporate the patient safety framework in our undergraduate training. As a doctor, when you go through medical school, you don't really, and I think you can support me on that, you don't really get to be taught how to incorporate patient-centered care. What you're taught is but you hardly ever take the time to understand that that individual that you're looking at actually has a whole lot of other circle around them, which includes the immediate family, which includes relatives, which includes the community, etc. So I think our training should also focus on that. Then the second thing I think that we can do is to rope in our regulatory organizations. We have ones that would regulate nurses and ones that would regulate doctors. And actually that stems from the fact that when you did analyzed our patient complaints, the first complaint that they would present with is issues around staff attitude. And to actually address staff attitudes, we do need to go back to these councils that regulate our healthcare workers so that we can push the agenda of them looking at empowering their members to actually work differently. And I think if we attack it from all those angles, we can literally bring in the focus of patient-centered care to our facilities.
Absolutely, yes. A very critical role. And I think as we think about, again, the health system moving, we've started with the role of the nurses, then the family doctors, hospitals. Next, I'm going to go for the public health discussion because collectively it all comes together oftentimes. And so much greater than half of patients, of course, are seen in those government public health initiatives, but also just from regulators' perspective in the way that public health, the role of public health in multidisciplinary teams. So again, share with us, Bettina, how you believe public health fits into the importance of multidisciplinary teams.
Thank you. And again, I said previously, health is our issue. And perhaps you have heard the WHO call health for all, and then with a year behind it. And we like to say health for all, including those who provide health. That means healthcare workers around the world. Because public health looks at healthcare systems and how health is provided and health care is provided. And when we analyze this around the world, we see, unfortunately, that around healthcare workers, there is a high level of illness, of overcharge, of mental problems. And we think that healthcare systems where the providers are unhealthy, that the systems need a change. And we are looking into this. We are looking, as my neighbor said, into the differences between countries and between systems, and we are trying to propose changes, and we will talk about that later. In addition, public health, we work together with those who provide. We have an MOU with WONCA and the World Psychiatry Association concerning mental health, because we think mental health is something that happens in the community, happens directly in a primary care physician's office, happens when a nurse deals with a somatic problem, we'll see it. So we try also to make this collaboration working, and you mentioned multidisciplinary teams. Yes, that's something of things we as public health people looking at health care systems support. But we also want to open up the, let's say, separation or siloing between health care and health, because health care should not be isolated from what we're talking about, health itself. And sometimes in some places, this is quite siloed. So these are issues that public health people around the world address. Thank you.
Thank you, Bettina. And I often say, unfortunately, so many of the systems around the world, I think the majority, are designed for sick care, not health care. Right. And so I do think that in thinking about how we truly support those who care for us is flipping that script to be more focused on overall health and well-being of all different types of health, not just physical health. So that brings me to you, Dr. Dai, and the work that WMA is doing. I know you all have a number of policy statements and declarations. So share with us how you're actually moving implementation of those instruments forward.
Thanks. Thank you so much. So I think I just want to look a bit into the background context of caring for the carer. And I think it's important to remember that the carer himself or herself would also at some stage be a patient as well. And that, I think, is what we forget as society. And I think at this juncture, it is really fitting for us to look at how a safe working environment for healthcare workers is provided. We've just been talking patient safety all the time. But what about our healthcare workers and their working environment as well? And the WMA has spent quite some time considering how to develop or start implementing a future path towards equitable access to the basic elements of a safe working environment for healthcare workers. Now, ranging from life-threatening blood-borne pathogens to safety and security in the workplace, the question that we ask is, how do we protect them and care for them who care for us? and lived experiences even within our country in South Africa is that healthcare workers are attacked, robbed at their workplaces as well. They're hijacked on their way to work and they're killed. And I think we need to consider this aspect and look at how healthcare is in danger because of the danger issues associated with really looking at our healthcare workers as commodities to provide a service and not really looking at how we should be protecting them. So when you look at healthcare workers, they provide care in every country and to every social and cultural group, whether the contexts are sophisticated or whether they're humble settings, they're there to provide their services. I'm not saying that all healthcare workers are angels. Yes, you do find those that we've heard complaints about in the room yesterday, but are these the majority of healthcare workers? I think the global reach of healthcare workers is matched only by the significance of the work that they do. In all corners of the globe, we depend on healthcare workers for their life-sustaining services. And so I think it's important that the basic measures for protecting healthcare workers need to be viewed everywhere as essential. Their basic services and their basic care is just not even considered at all. So I think it should be viewed as essential, and it needs to be included in the national health priorities of all nations. The resources for this task are probably unlikely to be forthcoming unless we as society start reassessing how we value our healthcare workers. So I want to go back to COVID-19. Prior to COVID-19, just look at medical litigation. It was sky high. And healthcare workers were the scum. Doctors were the scum in terms of healthcare provision. Come to COVID-19, and suddenly doctors are the saviors. And we're just stepping out of COVID-19, and society has really got short-term memory because they've actually forgotten the role of doctors and the importance of what they do. With regard to what the World Medical Association is doing, besides its numbers of policies and guidelines, etc., and when we look at the WHO document that was discussed today, the Global Action Plan on Patient Safety, much of this is reflected in the WMA policies as well. And these policies are then passed through to the national medical associations, and the national medical associations then take these policies across to policymakers and start also domesticating within their national jurisdictions.
So I think that that leads me to the perfect next question in regard, and I'll pose it to the entire panel, anyone who wishes to address it. How do you feel that patients, patient advocates, who are most of us in the room, health and healthcare providers can collaborate better to initiate systems change and policy change?
I think it's really important for patients and healthcare workers to look at each other as true partners. And, you know, we've had societal change, we've had trust deficits, within the healthcare patient relationship. And I really think we need to reassess this relationship. And we need to learn to start trusting each other. We also need to understand the context in which healthcare workers work. For example, we talk about informed consent, and we talk about how important it is for the patient's autonomy to be respected. Does the busy healthcare worker, does the busy doctor have that time? You know, you look at it, South Africa, 1 doctor per 3,000 patients. Consultations limited to about 5 to 15 minutes. Insurers won't pay for more. And society, our patients don't work with our healthcare worker workforce in terms of partnering together and fighting for what should be their rights and what should be healthcare worker rights as well. Remember, with restrictions like this, what's going to happen? Safety becomes a problem. You can't be safe if your healthcare worker isn't able to provide adequately for you in terms of having that time to go through a consultation appropriately. Also, you need a safe environment for your healthcare worker to work in. You need resources. South Africa, again, systems failures. We have a 2-tier healthcare system, but I think there's systems failures in both the tiers. And where the environment for healthcare provision is not safe, the healthcare worker is not safe, and the patient is not safe.
Thank you. I agree. And I think that we've heard those common themes throughout the last day and a half of trust and the importance of trust and how change happens at the speed of trust. So we can't expect effective change without that trust. Howard, I'm going to go to you and get your take on how you believe that nurses can collaborate alongside patients specifically to improve that quality of care and or policy.
Yes, I think all of us have agreed at a starting point that there's a shared agenda between staff and patients for safety. So practically, how do we do that? How do we deliver that? I think we have to look at what systems do our health organisations have in place for listening to patients, for listening to staff as well. There's often, we hear our doors are always open. The patients come first. We want to hear what our staff have to say. But what actually is in place in terms of the systems, the processes to enable, for example, staff to come together, to meet regularly, to review where care has been given well and where it hasn't, what the reasons are for that. How is that then fed up to a board for a discussion? How does it inform the quality insurance systems within hospitals? Similarly, the data on patient experience, patient feedback as well. How's that collected? Where is it shared? And then critically, how do patients staff also see that their feedback is acted upon? One of the quickest ways to turn people off engaging in this way is that you say, oh, my door is open, I want to hear your feedback. People do it, and then they see nothing happen or nothing changes. So I know it's dark, but some of those governance processes that organisations should have in place, transparency around data. How do people complain? How do our systems deal with complaints? A lot of our experience in nursing is that when something goes wrong, many nurses are fearful because they see the experience of colleagues that it's the individual who ends up getting blamed. And what we all know is that, of course, every profession, there will be a bad apple, there'll be rogue practitioners. I believe they are really, really not a minority. But when you look at when things go wrong, often you'll see a lack of resources, people too stretched, under pressure, voices not being heard, poor leadership, breakdowns in communications as well. But when we blame the individual, we then send a massive message to everybody not to raise issues, not to raise concerns as well. If I was making a choice about the health facility that I go to, if a hospital says, we hardly have any zero or close to zero complaints, and another hospital says, yeah, we get, 10 or 20 a month or something like that, I'd go to the hospital that has more complaints because it speaks to the culture of the organisation. And that can often seem as though it's a soft word, it's not a serious issue, but it absolutely is a core issue that speaks to the values of the organisation and of the leaders as well. And the pandemic was mentioned, and I agree that I think a lot of the lessons from the pandemic are being very quickly forgotten. The pandemic exposed the lack of preparedness for the world. Not enough PPE, vaccines, systems that hadn't properly planned and tested themselves for a pandemic, which we know is going to come, and another one's going to come as well. But who always bears the consequences of the failure of our health systems to be invested in and properly prepared? Firstly, those people who have a health need, and sadly, the millions who die, but also the healthcare workers who are having to deal directly with patients when there isn't enough oxygen, there aren't enough beds, choices being made about vaccines, and healthcare workers themselves.
Yeah. And I think this notion that you mentioned here about the listening, the importance of listening to that patient experience. We heard this morning of a wonderful example in Saudi regarding a patient and family advisory committee and how that was that experience is feeding back into specifically the hospital setting. So Dr. Dijks, share with us how you think that patient experience can help to enhance service delivery.
That's a very good one. For any hospital or facility to know what to prepare for, they need to know what the patients actually feel about the service that they render. So we do have, at least in South Africa, what we call a patient experience of care survey that we conduct, as well as patient complaints and management system, as well as patient safety system. So we normally then take the three and analyze the data that comes from there so that it can then inform what systems or what interventions were actually put in place to improve our services. So having to hear the voices of the patients in whatever platform that they send through their comments on, that information becomes quite important. But it's one thing to have the information, but it's another to actually analyze it, understand it, and actually use it for planning. So what we try to do is, as we get that information, we do analyze it and put it into the local context of that particular facility, and we develop what we call a quality improvement plan that is specific for that particular facility for them to address the issues that have been raised.
So listening is not enough. Taking that back into a continuous improvement, quality improvement plan, and ensuring that, again, it's adequately addressed in the right ways. I often say there are different incentives and disincentives in healthcare. And so how do we continue to evolve our healthcare systems with the proper incentives and disincentives for those that are supporting and working in the system as well, not only just for patients, but also for providers. So I want to go to you, Bob, specifically, if you're thinking about how family physicians, we've seen such an evolution in the last 5 or 10 years in what I call shared decision-making and patient empowerment. If you were to fast forward another 5 or 10 years, how do you believe that will change the dynamic between patients and their family doctors in shaping a better healthcare system?
So shared decision-making obviously is a goal, I think, of every consultation, if that's what you're referring to. And
Well, maybe I clarify.
Say again?
Because there was a study done actually on shared decision-making, and 98% of doctors believed they were doing shared decision-making. But when objectively assessed, and also with the patient's perception of those encounters, fewer than 10% actually were doing effective shared decision-making. So when I say shared decision-making, I mean inviting the person into the opportunity to share the decision, adequately weighing pros and cons, risk and benefits of the treatment decision, and then supporting whatever decision that person makes that's best for them. So that's what I mean by comprehensive shared decision-making.
Yeah, so look, I think it's a goal for all of us as family doctors to have shared decision-making, and we train our medical students. And it starts, of course, with listening to the patient and understanding actually why they're here, what their needs are, what their viewpoint, what their perspective is, what their expectations are, so that you can address them and incorporate them in a shared decision-making process. Do we do that well? No. I mean, I think we would agree. Why don't we do it well? I think there's a lot of reasons for that. First of all, there's this very strong biomedical model that people are trained in that doesn't really nurture a person-centered approach, and that needs to change. But then it also relates to some of the issues that we just discussed. You know, if you have only a few minutes to see your patient because there's a queue of, 40, 50 people outside your door who are all impatient, then as you're put under pressure, you tend to become less person-centered. And in fact, your goal often becomes, in the public sector in South Africa, the goal is often, how do I get through the queue so we can all get out of here by 4 o'clock? That is the reality. Yes. And that is the death of shared decision-making and person-centeredness.
Well, I think it's so true that when we are under stress, any of us as people, right, and healthcare workers, that our fundamental, beliefs and behaviors are taxed, right? And they're pushed to the limits. And so I think that it's natural, and I appreciate that you recognizing that and calling it out, because I do think it's the same. Think about on the patient side, if you're dealing with a new diagnosis or with something you don't really understand, a lack of understanding, you're stressed, and so your best person may not show up in that encounter either.
One of the important things on the patient side of this conversation, is empowerment of patients. So we've seen that as we empower, for example, diabetes is the leading killer now of people in South Africa, actually. And as we see that we empower people to understand diabetes, and we're doing that not in the consultation, but taking people into a group empowerment process. But when they go back into the consultation, what we've discovered is now they understand something about diabetes. They understand something about what should be happening, in this visit to the clinic, and what, their blood result means. So they engage then in the conversation far better and start asking, much more focused questions of their nurse or their doctor. So patient empowerment is a really important, building health literacy is a really important part of enabling shared decision-making. Yeah.
So final question I'm going to give to Bettina, and it is in regard to the topic that we have all heard, the buzzwords of health system resiliency. How do we build health system resiliency when we have all the challenges we've heard about here in workforce, in training, in time, in trust, in lack of transparency? How do we begin to really think more at a strategic level around health system resiliency?
Thank you. And thank you to my neighbor and all of you talking about the stresses that are on healthcare systems worldwide, resource restrictions and so forth. But there is a high level of inequity. My neighbor here said there is one doctor per 3,000 in South Africa. There is one doctor per 330 in the EU. And please be seated, you are. There is one doctor per 180 inhabitants in Geneva. I think this unequal distribution is one of the things we have to tackle. I talk about brain drain. I talk about the migration and the stealing of health care workers. Countries actively go to places like South Africa where there are well-trained nurses and call them to come to their country. This is creating unequal access, inequality in resources. And we, as responsible people, have to look at this factor. I think it's really crucial that we stop this brain drain. And I think that people who are trained here in South Africa would love to be in South Africa with their families, with their friends. But when the economic situation, the working conditions are not, they have to migrate. And you know that migration, we're talking a lot about migration, is work migration. And now I come to the second point, the elephant in the room that hasn't been mentioned at all. 80% of healthcare workers are women, right? Okay, nobody talked about the fact that in healthcare we have a female workforce, and for nurses, it's even higher. If you have a male nurse, then he may be in a leading position in the hospital or in an administrative position. But you find very, very little male nurses and also male doctors, pharmacists, and so forth. Happily so in the family doctors. This is still not the case, but why do I talk about the fact that this healthcare world is run by women? There was a UN Congress saying with the title, Health Produced by Women, Directed by Men. I think we have to address the fact that we need a change here and more diversity. We even need male nurses. Why? When I was, you heard in the previous, I'm a trained histopathologist, and years ago, so don't take it for today's, I had my first presentations in an international congress, came back to my professor to tell how my congress presentation went. You know, it was in English, stress. In the institute where I was at the time, there were only male colleagues, only. And I was also telling him, you know, in Portugal and France and in Spain, women are doing pathology. He leaned back like that and he said, look, Ms. Borish, in these countries, pathology has no power and they don't earn any money. So it can be done by women. I didn't know what to answer, but I will never forget this. Why am I telling this old story? Because I think in healthcare systems, our incentives are wrong. Our incentives are going to privatizing things, to make money out of suffering people, splitting societies by offering for those with a credit card more. And I think splitting societies is what we should avoid, because equal societies that show solidarity are healthy societies.
Yes, yes. Agreed. Thank you, Bettina. Yeah, so we're running a bit out of time. So I am going to invite our chair back up for a few final comments. And I think that we've heard such powerful themes around how we can support those who are caring for us to build better healthcare systems. And again, thank you all for your insights. It's been wonderful working with you as the moderator today. So Chair One.
Thank you so much. What a fruitful discussion, and thank you for your insights into this particular topic. Just a few comments, I think, just from what the moderator opened with, the colony story. And I think what I took from there is that we can't do it alone. So from the discussions as well that we've had here, it's quite clear that multiple partners are actually needed for us to come together and be able to protect and take care of our workers. And I think another quote that came out is health for all, including those who care for us. So again, as we plan for taking care of our patients, we do need to plan for taking care of our own. And that talks to even having a health clinic for staff at health facilities, occupational health and safety, employee wellness programs, so that we can be able to really take care of them. Issues around safety and security were also highlighted, and quite frankly, you may have heard stories in South Africa where even our EMS drivers would be attacked as they go to fetch patients. So again, we do need to focus on how we take care of the safety of our healthcare workers. At a hospital that I once worked in, one nurse was actually stabbed by an escort of a patient. So again, it's talking to how do we protect our healthcare workers from harm in general. And I think the important thing is that we need to create a no blame environment, especially when it comes to addressing issues of patient safety incidents and even complaints that we have. And so the way the management and the managers of facilities react to these conditions or these complaints that have been raised, we do need to find a way of how we actually address that in order to empower our healthcare workers rather than blaming for things that have gone wrong. But again, is to say that the equity story that was spoken about plays a major role in how we actually get to deliver safe health services, and also how to take care of our workers. Because the fact that we have brain drain, it means that there is a hospital or a clinic somewhere where there are one staff short, and we expect that everybody else should carry that load. And at the end of the day, when mistakes happen, the way we react to those mistakes become questionable as well. So thank you so much, colleagues, for your insights. And I think it's a task for everybody as we go back to our different countries, as we go back to our different environments, to really start looking differently at how we take care of our healthcare workers, and more importantly, so creating an environment that will be conducive for them to grow, conducive for them to really want to wake up in the morning and come and serve. So I think at the end of the day, it's all up to us in this room to ensure that we create that platform. Thank you so much.
So now we'll be going to coffee break. And if we could please return to the room at 10 till noon, 11:50. So you've got about a 20-minute coffee break. Thank you.